on here. I guess just first of all, what would you make of Mike Israel's comments? Let's get that, and then we'll get into what we were really going to talk about.
Hi. First of all, happy birthday, Sabrina.
Oh, thank you.
It's a great day to celebrate. And we really need to take the time to appreciate all the things that we can, and we want to celebrate you today. So thank you so much for everything you've done for Guam and for the message and the advocacy that you've done for everyone. And you are truly a lifesaver, and we appreciate you.
Oh, thank you.
Wow,
appreciate
Doc.
that. Wow.
Wow. Jeez, I didn't even go that far.
It's not your birthday yet, Chris.
Now I got to, though. I got to write Bria a letter.
He's going to be tomorrow's my birthday.
Yeah, Doc, so I guess just first of all, if you want to comment on what Mike was saying.
Well, sorry, I was listening in and out there because I was moving. I think he's definitely entitled to his opinion on the matter. What you're seeing here is you're seeing a large variety of opinions, and mainly that's because this is not easy. That this is very difficult, difficult to handle. This is unprecedented. But what we have to remember that the advantage we had here in Guam, which is that we had a crystal ball in looking into the future, and that future was Italy. That future was New York, and we knew that how dangerous this virus was, and we had an opportunity to do so much to not become those cities, and so that was important, and that's something that we have to really focus on. And actually, and right now what we're seeing here is that we've actually so far have done a good enough job to at least prevent that from happening, and we want to take the time to understand really what impact our actions have now, because we were basically doing what we can to follow other countries that have so far been successful. We're not doing anything that unique, really. We followed examples and different recommendations, and so far it's proven to work. And I think the thing that was the most effective was our early actions.
Right. And then that being the social distancing and implementing, right, shutting down the government, right?
Yeah. And so, in terms of, the numbers and the projections, I get it. It was scary. It was scary for us. We couldn't sleep. I felt sick to my stomach. I couldn't eat, after the first view of those numbers. And the governor has put people, in terms of us advising her, who was going to lay it straight and not necessarily sugarcoat anything. And we did that. And again, these trajectories were not forecasts of our fate. They were a projection of possibilities, not saying that it was going to happen. And so people just say that, it's this date, and they said that we were supposed to have this many on this date. That was, those were projections from 3, weeks ago or so, and that we're looking at a possibility of that happening. It hasn't happened, and it's because of our actions early. It's not like a typhoon forecast where our actions change the course of the typhoon. It doesn't. But in this case, with this disease and with how contagious and rapidly spreading it is, our actions actually change the course of it. And that's a unique advantage that we have with these projections, and we took advantage of it. And because of that, we're seeing the benefits of it.
Yeah, Doc. I mean, people. Do you take it personally when people kind of say like, "Oh, Dr. Doomsday went out and said, oh, doom and gloom"? Because I can definitely see that you guys made this trajectory. The first one, with little data, like the governor said, but you stand by that trajectory as the right call for that time.
Oh, absolutely, 100%. Stand by it, and I'll take that to the grave. And the key thing in that is that we did not do this alone. We did this in conjunction with the U.S. Army Corps of Engineers. Mm-hmm. We did this with the CDC. We did this with Johns Hopkins Applied Physics Lab. We did this with UPenn School of Medicine's CHIME calculator. We did this with a lot of very prominent collaborating entities here.
Are we talking about the first projections, or are we talking about the?
Oh, just overall.
Overall, okay.
In the first projections, it was the U.S. Army Corps of Engineers, and with some input from the CDC as well, and then also with other publications that have been around. So we didn't just make up these numbers, and we didn't just plug in things, like randomly, like the comment, garbage in, garbage out. It's the best that we had at the time, and we had to make and like I say, it was pitch black, and we needed a flint of light to at least have a view of what might be we facing. How big could this monster actually be? Mm-hmm. And because we saw what it was, we were able to act accordingly. There's this really great publication by Thomas Puello, and he is a brilliant writer. He's put a lot together in terms of the coronavirus and different parts. It's a multi-article publication, but he talks about the hammer and the dance. Mm-hmm. And he talks about the hammer having to come early and then the dance afterwards. We in a sense we placed the hammer down over these past several weeks, and what he wrote was that it had to go on for about 3 to 7 weeks in most areas. Right now we're entering the dance phase, and so this is the search and destroy phase where we have to now find where the coronavirus may be hiding, because anywhere it's hiding, even one person can spread it rapidly. And so we have to be sure that we identify them and be able to contain it and control it, so that, again, what's the primary goal in what we're doing? Why are we doing all of this? Mm-hmm. We have to remember, it's not because we're worried about 100% of the people that catch coronavirus are going to get deadly ill. No, it's because of that small percentage that's gonna get very ill very quickly and overwhelm the hospital system and then increase the mortality rate. That's the primary goal, and we have to focus on that. So to use these anecdotal messages about, we got sick throughout the office and we're all fine. Yeah, because that's what the virus does, and it makes you fine. And if it killed off everybody, it wouldn't be an effective virus. It wouldn't spread. It'll kill off its host way too quickly. But it's just the right amount of enough people that can go by and not get tremendously ill from it. And right now what we're finding is that even more and more so than we suspected is that there are many asymptomatic spreaders.
Right. Yeah.
And so if you're young and healthy and you have a good immune system, great. You're probably not going to feel sick, but guess what? You probably could still spread the virus without knowing it.
Mm-hmm.
Doc, just real quick, just going back to what Mike was saying, how responsible would it be to just open the government of Guam today?
Well, what do you think, Chris? I think I think it's very clear what my answer would be, but I like to hear what you think that might.
I think it's a little crazy, but yeah. I mean, we are having those conversations, right, Doc? I mean, you can't really fault people for looking at that recovery, because that's the conversation that we're starting to have now. The governor has said, she's been very clear, and I'll go back to the press conference yesterday. She said, hey, we have 14 days of 0 to minimal cases, and I'm not sure what minimal would be. And then we do all these other things. We do the mass testing. If that looks good, then, I mean, she basically said, yeah, we're going to start to reopen the island. That doesn't mean they're just going to open up the gates and, tear down the checkpoints and everybody go do with, everything. And I'm sure it's going to be incrementally in some sort of baby steps. Right. But so how do we continue to take it? Like, because I'm on board. I'm taking it serious. I realize, like you said, 80% of the people who get this virus are going to be fine. But we're a very vulnerable community with the chronic disease, with the comorbidity. So I get it, Doc. I get it. We're doing our part. We've always been the ones messaging, stay home, stay home, stay home. Now the messages get tested. So I get it. But, people are thinking about reopening the island now because we're talking about it.
Look, I'm going to be the first to admit I'm not a business professional. I don't have, that's not my expertise. I don't understand the economy anywhere close to, many other, very, smart people on this island. But the reality is that you can't have an economy with very sick people and a lot of dead people. And so the understanding in this is that we are taking a very gradual approach. We're using guidelines. We actually think that the guidelines set out by the task force from the White House is extremely well written, and it's very good. And what we're doing right now is we're using that to adapt to one that's specific to Guam, using a lot of those guidelines. Ricky Hernandez is here from GITA is doing a great job in drafting that up. And we're reviewing it. It's heavy on the medical recommendations as well. There's different things that we got to check mark. We went over some of that yesterday during the press conference. And these are things that we're not just making these things up ourselves. They are based on very, very well thought of guidelines, and we want to do our best to follow it, because that's the light on the path that we have to follow.
Mm-hmm. So basically, decisions that are going to be made on the reopening of Guam will be based on the findings of this mass community testing that you guys are going to launch.
It's not. That's only a tiny part of it. What this is, what this community testing, again, is targeted toward some of the population that, again, probably have poor access to care, and so it's us shining the light on other parts of that may not be on the path that we are right now.
Right, but it's also this, because you guys are in this new phase. You're also making sure that people know that you can also go to any of the clinics and get tested, or a private clinic and get tested.
Right.
Yeah.
So based on the
Absolutely.
data that you receive, how you're only saying that's going to be a little bit of a portion of the decisions that are going to be made?
Sorry, I thought in specific to what's going on this Saturday.
Okay.
That's what I. Yeah,
No, I just meant testing in general.
Testing in general, yes, that's going to be a big part
Okay.
of it, and so that, because we don't have a true, real confidence in our sense of what the actual prevalence on the island is.
Right.
GMH has another COVID positive admission. Okay, and so
When was this, Doc?
as my knowledge is as early as yesterday.
Okay.
Just one?
One new one.
Okay.
Yeah, so there's 2 right now as of this morning that are admitted. One was discharged. There was 2 yesterday. One was discharged, and then there's a new one admitted, and so there's 2 this morning as of the report I got.
Okay.
And so to think that this is completely done is this is one very small example that it's not. That there are still active cases. God bless Naval Hospital, because their number of cases admissions are still rising. That's a whole different entity, and that's a different process.
What do you know about that, though, Doc? Because we don't. I don't know if we get that info from Naval Hospital, but are you aware of how many hospitalizations, COVID hospitalizations, are at the Naval Hospital?
I don't know what it is today. And the basic numbers is that we, with the number of positive tests rising, I think they're seeing a proportionate rise in their admissions as well.
Okay.
I have no idea about how sick they are. I have no idea about how many in the ICU or what have you. But what it looks like is that it's following the what would be a expected proportion. Now they're a much healthier overall population. So it's a much, much smaller percentage of those who are infected that actually end up being hospitalized. And so thank God for that. But, it's something that, it's still a very, very real threat here on the island. And, if we peel things back too quickly, then we're starting to know enough about what this virus is, of how quickly it can spring up on us. And we have to remember, this is an exponential growth and threat that we had. And because of that, especially 3-4 weeks ago, we were talking about overwhelming the system within 5 days. And if people didn't act and take this seriously, and thank God people did, thank God, because it was a real disaster that was facing us. And because and this is a great credit to all of Guam and to the leadership on Guam as well. And I'm not just talking about government leadership, I'm talking about leadership in the community, leadership in business, who really took this seriously, took the right steps, even to protect their businesses that were considered essential.
Real quickly,
Sorry,
Dr. Cabrera, because we're running up against
Yeah.
the time, I did want to ask this because we didn't have the opportunity to ask it during the press conference yesterday, because we're only limited to 2 questions and then we get muted.
Right.
So I wanted to ask, there's this article on CNN and other publications that the maker of the Abbott ID Now device, which I believe are the 2 that we have on island,
Right.
they're saying that it can produce false negatives if a special solution is used to move or store patient samples. And that solution is a viral transport
The
media.
VTM, and so we had heard from Dr. Hoa yesterday that we are using the VTM and that we're actually short of it. So I guess our question to you is this report, these national media reports about the tests that is distributed by the federal government, and then again the warning that it can produce false negatives if a special solution is used to move or store the samples. Does that have any effect on the testing we've been doing and the large number of negative results we've been getting?
So here's the this is actually this issue that might actually be a blessing in disguise, and the reason being is because to have the right supplies and amount of the biotransport medium is a struggle, and that's a rate limiting step in our ability to do the test. The fact that we can use a simple swab and put it in saline and then take it and it getting run, that's the simplest way to run the test, and what it's actually showing is that's the most accurate way to run the test, and so that's an advantage that we have. Now, the test can only run one at a time, so that's a different issue. So there's a backlog, then we have to account for that. But otherwise, that's why it was very important that we have multiple modalities to run tests, because if there's limitations in one, we can switch to another. So that's a key part here. And so with the if we can't run it on the Abbott ID now, then they go on the ABI 7500 or the BD Max, for example, and those need the biotransport medium for them, and they're more accurate or just as accurate with the biotransport medium.
So how many tests have we run with the Abbott using the VTM?
I don't know that number yet, but I'll tell you this, that any of the high suspicion or any time that there's a reasonable suspicion, they were being rerun on the ABI 7500.
So are you saying, Doc, that even with these national reports about the validity of the tests that we're using, that you still stand by every test that we've run with samples put in that VTM on that Abbott ID machine? You stand by those results?
Absolutely not, and because that's the nature of the test, that it's never going to be 100%, so I don't stand by that, because we know that by nature we can't, because every test has a degree of false positive and false negative results. Now 85% positive, meaning a 15% potential false negative when you use the VTM, that is quite high, and that is quite concerning. And so we're gonna, everything in this whole process is understand and then pivot, right. And so we're going to continue to do that. And the more that we try and stay on top of as much of this, and we try and take that into account, and then we try and pivot when it really makes sense to do so, without hopefully not hurting ourselves in that same pivot.
So that's something that I guess you guys are going to be backtracking and looking at.
Oh yeah, absolutely, and that's something that that the lab has already been doing and been looking at really closely. The clinicians, as in the doctors and the providers, have all been looking at this very closely. It goes to the fact that these tests are not perfect, but that's why we still need to be very vigilant in how we test and in who we test, and ensure that we understand and that we don't just do mass testing, because mass testing is when you can get more of the danger out of it. And that having good profiles and understanding who we're testing is going to be very key to understanding if there's a problem that pops up in terms of the testing results.
Doc, I'm just curious, devil's advocate or just advocate again, if we have you as the primary point man in the governor's physicians advisory group coming out and saying that you don't stand by these tests, but then we have the governor saying that hey, we've continued to have zero positives. If we keep this up, we're going to reopen the island. You see, there's a little bit of a mix.
Yeah, maybe my word choice was poor. And so what I meant by I stand by them to the best that we can, and that we're going to continue to use the best that we can. But my main point in saying that was that no test is 100%. So that's why if we believe that there was really zero tests and we're 100% confident with that, then yeah, we'd be reopening right away. But we know that that's not the case, and then that we know that it's not a true representation of what's actually going on in Guam, which is why we have to be extremely careful. Because nothing we're doing is 100%.
Right. So are you saying moving forward, we're no longer going to be using the VTM for the test that we conduct with the Abbott ID machine? We're going to use saline solution?
I think that's going to be looked at extremely carefully, and we're going to try and understand that a little bit more now. There's even more other corollary studies that are being done, and so we're gonna dig deep into that and then really ensure that we understand that, especially before Saturday.
Okay. How many people are you guys looking to test on Saturday? I know that the mayor said it's 400 to 500 people population in that Saguenay-Lanezen, but we're only looking for people that have mild symptoms, right? Is there like a sample size that you're targeting?
Yeah, so public health is leading this effort, and they're the ones spearheading. So I can't comment too much on the operations part of that. But at least from my understanding, I believe they're looking to test around 1 to 200 or so. I think they will have the capability to do that on Saturday. But it's only, I believe, from 9 a.m. to 12 p.m. For that 3-hour window. So that time itself might be the limiting factor.
But if Dr. Cabrera was calling the shots, how many people would you want to see get swabbed on Saturday?
Well, I think that it's really going to come down to how do we test safely, because again, even though they're coming in, we're still going to practice everything in terms of
right.
social distancing and
right.
and all that. So just to push that on, it's just not a fair part here. I just want to really quickly just make the point that I talked about also people making sure that they try and reach out to their primary care doctors and get their maintenance care taken care of, and that they should feel comfortable leaving the home to do that. So it's not saying that we're rolling back our stay-at-home orders. That this has always been in place. That you should be able to leave your home for essential purposes.
Right.
It's just that what people they seem to forget or don't understand people seem to not put into weight the true value of actually seeing your doctor for preventative measures.
Right.
And we think that's extremely important. It's as important as going to the grocery store to fill up on food. And so we want to ensure that people understand that and they do that, and that's a very appropriate exception.
Yes, I think it's just that people got used to hearing "stay home" and then "stay home, stay home."
No,
but,
stay home, but
but the essential stuff. Yeah, and this is something we talked about with Dr. Hoa. Is we don't want these people with chronic disease who are not doing the maintenance they need to do to take a nosedive and have to be hospitalized and take up.
Yes. And then if you're feeling ill and getting tested, that's also a very reasonable exception to the stay-at-home order as we enter this new phase, the dance phase.
Okay, Doc. Thank you.
Yeah.
Hey, appreciate it, Doc, so much. Appreciate your time.
Thank you.
Take care of yourself and each other.
Okay,
right.
you got it.
Be safe.
Wash your hands.
Yeah, thank you. I will.
Okay, Doc. There you go, Dr. Felix Cabrera.